Seizures can be caused by many things, like stroke, a really high fever, or low blood sugar. And sometimes, though, the cause is unknown. Dr. Frida Lewis-Hall, the Chief Medical Officer of Pfizer, is back. We're going to talk a little bit about seizures and what to do if you witness them.
So let's talk about what a seizure really is. If you think about our brain function, all of our brain function depends on our nerve cells talking to each other through chemical and electrical activity. If there's a surge in that activity or a break in it, that's a seizure. And if you have two seizures for unknown causes, then that is a disorder we call epilepsy.
And this is important to talk about because there are different types of seizures. In a partial seizure, you may see uncontrolled movements, but they may progress to what you're seeing here, a generalized seizure involving essentially all body parts. They typically do last no more than a minute or two. But another type of seizure entirely is called the absence seizure. It's most often seen in children, and its symptoms are very different. Joanne and her 7-year-old son, Julian, are here with us today. Julian has absence seizures, and what has your son's experience been with these?
He started having these episodes where he would take a deep breath, he would blank out, and it was like pressing pause on a DVD player. He was out, his body would freeze for 5 to 10 seconds, and then he would come back and have no memory that any time had passed by. And he was having them at least 15 times a day.
Let's take a look at this video. It's of another child having an absence seizure.
Tyler.
Now, first of all, hi, Julian. How are you?
Hi.
Good. I have a question for Mom. So, is this similar to the experiences that Julian was having?
His were a little more dramatic. We thought he was having hearing problems at first because we kept calling his name and he wasn't reacting to us. And his teacher thought maybe he has ADD, he's not paying attention, he's not taking direction. And he also started stuttering because he was having these seizures so frequently that he would be in the middle of a sentence and he would lose his train of thought and start saying, And we didn't know that he was actually having seizures.
And we talk about that idea of the blank stare, and sometimes children with these absence seizures, they are wrongly thought to have attention deficit hyperactivity disorder because they do. They look like they're daydreaming, looking past you and ignoring you.
How did you find out that Julian was having seizures?
Well, we went to the pediatrician for a checkup, and I asked the pediatrician, I said, he's exhibiting these behaviors. We don't know what's going on. And during the exam, he had a seizure right in front of the pediatrician. I said, that's it, that's what he does. And the pediatrician immediately said, oh, he's having an absence seizure. And within 3 weeks, he was on medication, and 4 days into the medication, he completely stopped having seizures.
Well, that is such good news. Joanne, thank you so much for sharing your story. Julian, thanks so much for being here, bud.
If you see someone having a generalized seizure, like the one that we saw in the earlier video, here's what you should do. Make sure that you stay there for the full duration of the seizure. Stay there till the end. Ease the person to the ground so that they don't fall, and make sure that everything is loose around their necks. And make sure, if you can, that you turn the person on their side so that you keep their airway open.
And there are definitely some don'ts. Don't stop their movements. Don't force anything into their mouth or try to hold the tongue down. This can be very dangerous.
Absolutely. And if you have a seizure, make sure that you call your doctor and tell your doctor what has happened. And for more information on seizures, go to gethealthystayhealthy.com.
And you can also visit thedoctorstv.com. And remember, consult your healthcare provider with any concerns when it comes to your health. Thank you so much.
Thank you.
Coming up, we're sharing information everyone must hear to have a healthy and safe weekend. We're also going to see the results of the new facial filler procedure. Stay with us.